everyone. I am extremely excited to be sitting here today and having the opportunity to talk with Dr. Dustin Costescu. He is an individual I've been hoping to speak to since I started the process of getting this show ready. And I invite you to spend a few minutes and just absorb some of what he has to say. So, Dr. Costescu, tell us, what is your professional role and how does your work that you do specifically help those in the 2S LGBTQIA plus community start or grow their respective families?
That's great. Thank you so much for having me, Sam. It's a pleasure, and thank you to all of you for listening. So I'm an obstetrician gynecologist at Hamilton Health Sciences. I work out of our McMaster site. I'm an associate professor of OBGYN, and my sort of gynae world, gynecologic practices around sexual health and family planning. And a lot of the work that I do is actually in the trans non-binary community, as well as see a variety of queer patients in clinical practice. I'd say I'm one of the few, although growing number of OBGYNs in our area, and work with alongside a lot of other queer members of the sort of birthing community, particularly in midwifery and some in family medicine as well. So my role can be very diverse. For some people, it's about helping people not have their families, and some of our trans patients. But also, when we're having conversations around bottom surgery and things like that, these often dovetail into conversations around what would our reproductive options be. And I think what can be very helpful for me as a provider is just helping people to understand a lot of the terms that they've seen on the internet, helping my colleagues actually understand some of these terms that get used very commonly. A common one I think about in my practice is reciprocal IVF, which I think many people here know what that means, where one partner's eggs are being used and another partner is carrying the pregnancy. But these terms that get used very commonly in our community, we all know we have our own language, don't always translate to the medical side. And so that's a big part of it. Hamilton has a growing number of surrogate or gestational carrier families, and so sometimes the intended parents are going to be here with us. Sometimes we're meeting them for the first time at delivery, and again, that's another way where we see people grow their families, and then occasionally some of our birthing patients are going to be placing their children for adoption, and we also help families grow that way. So I've had the pleasure of being involved in all of those permutations, so to speak, and it is truly a privilege when I get to give back to my community, right? We know we're a small percentage of the birthing community, but we're here as parents, and we're proud to be here.
Excellent. And it's so true. It's so true. We meet small but mighty, our group.
Yes.
Are there things that you might look for working in the capacity that you do that your clients would argue makes you a better suited to work with the 2S LGBTQIA plus community than perhaps your heterosexual professional peers who work in a similar capacity? And not to slight them, I don't think
Yeah.
that they would do it to be disrespectful, but
Yeah.
just something that you may automatically think of or look for.
I think that's a great question. I teach a lot of our medical students and residents around just the kind of standard concepts of sexual identity, gender presentation, sexual orientation, and that. And what I think that for a lot of us as queer providers is that we get it and we accept it at face value, and it doesn't shape us as much in terms of kind of our othering of people. And what I say to my colleagues a lot is, if you can just understand that a guy, can be pregnant, that a guy could have endometriosis, and just watch how we sort of use that language, the rest of it's really easy. And I find that for some of our cis hetero colleagues, they just get caught a lot in the weeds of it. I think also, many of us have had that experience where you get the sense providers may be a little bit afraid of us, out of a place of good, try not to offend. And I think also just because, like all of you, I'm sure, have had those, be they microaggressions or, well-intentioned, foibles, I think we just kind of get that. I'm going to challenge myself though. I think that one downside, when you choose an obstetrical route is, we're part of a large group practice, right? And so, it's great to be able to create some of those safety nets around our patients, but we lose a bit of that in our call system and things like that. So, but I think it's important for people to understand whether an obstetrical consult is needed or obstetrics is a better fit for them, or, we need to transfer care maybe because of medical issues that, there are providers that are challenging the status quo of our profession to be more inclusive, and to kind of to be actually members of the community that we're serving.
Hmm. Hmm. Are there any pearls of wisdom that you have learned over the years that your clients are especially lucky to learn from you that they may not learn from anyone else?
Oh, that's a good question. I think when people get to be their authentic selves and we can have those conversations, it just makes for a better experience. I have an annoyingly good memory, so I always try to learn at least one or two kind of non-medical things about every patient, and I'll bring it up later on, and they're always very surprised by that. But I think many of us who've encountered healthcare experiences where, we've maybe been a bit protective or, didn't want to disclose our identities. I think when people do that, they miss out on the real potential to include their family members in the birth experience. So I think, I, I guess my pearl would be, as you feel comfortable, be as authentic and honest about who you are as possible so that we get to know you and then we can help, kind of shape, that experience around you, because there's a lot of work that we do in the background also to help make sure that our nursing staff and our technical staff and that our the charts are updated in a way that's inclusive, be it gender or relationship wise, and so the more information we have, the more we can kind of get the rest of that experience set up for success. um Other pearls, I think because many of us, my I have two children, mine are 10 and 12. So, and by no means would I consider myself sort of a first generation queer parent, but probably like between the first and second generation, many of us are still going through it as the first, even within the queer community, and you may be the first within your own social networks going through it. So, I think as give yourself permission to have some shared experiences with the cis hetero community around our transition to parenthood, and the challenges of raising a toddler, and oh my God, we're having another kid, and what does that mean? Those are you get to actually be a part of this other group, that you didn't think you get to be with, and in some ways that does actually help you relate, to that community as well, and it's kind of fun to have those dual roles. So I would lean into some of those experiences too, and know that they are part of the shared experience of becoming parents, and you know no matter how radical you are, because I was there, your kids will be your kids, and they might turn out to be very by the book, and you might be going to dance classes or hockey and all of that. You don't know what they're going to become. So I think just, allowing yourself to have that experience,
Mhm.
from the get-go, I think can be very, very positive. So I think, yeah, those would be my pearls. Sorry, I never have a short-winded answer to
That's perfectly
my
okay. I like the long-winded answers, and I like that suggestion because many of us in the community who have children that are older, so myself, my kids are adults, and I have a teenage stepdaughter, and you're right, we've spent so much time looking for other families that look like ours, but we also have to be open to spending time with other families that don't look like ours and sort of learning from one another because we can all learn, and I think when we think that we can't, then that's when I think the challenges can present, right?
One of the things I always said I would do when I was on my parental leave, in all your free time, because you don't know what you're about to sign up for,
Right.
is to try to set more relationships, with other queer families, even in the Hamilton area, and it just didn't happen because you're busy parenting. And so I think that's the other thing, that is, for listeners who maybe aren't going to become parents or are thinking about becoming parents, even finding ways to help strengthen and create family friendly spaces for our families, is another really powerful way to be an ally, to the community. So yeah, yeah, that's probably the other thing. Sleep and go on as many dates as you can before you have a kid. That would be my other pearl of advice.
That's so true.
If you don't
It's
have
so
your
true.
kids.
Yes, because I thought all that free time isn't really as much free time as you thought it was
Yeah,
going to be.
exactly. Exactly.
um, So you've been there, you've done that. Can you tell me when you went through your process,
Oh,
were you ever made to feel as though you were the other? And I use the air quotes, but
no, no, for
there.
sure. I think that's a great question. So my children are adopted, one through the public system, one through the private system, and I would say the public system was sort of inherently just more inclusive. Actually, at no point did we feel very different. I think that going through the private system the second time, and at the beginning where, now even, you date online, you meet birth families online. I think something that I came to understand was that, even within the queer community, people feel very strongly about how they create their families and respecting those differences. And that actually, because they often come from a philosophical place, there can be a little bit of headbutting around that. So I think sometimes creating my family through adoption, others meet from other, two dad families that use a surrogacy route, and I think our
Mhm.
experiences are actually very different. Um, but I think what's always interesting is there's strengths you can play to, as a queer person. And so what we always said was, as queer people, like, adoptions really are plan A, and that actually potentially makes you a strong, candidate to a prospective family, because they really see that as, like, you're out there choosing this as the way to build your family. So see that experience and see that thing that makes you a little bit different as a strength, and help others to see that part too. I was at the delivery of one of my children, and I had just graduated from residency. So I was a licensed OBGYN in a province where I couldn't practice, watching someone give birth to my kid. And I will tell you, that is a very humbling experience.
I bet.
And it was such a privilege. I always say, like, Sam knows this. This is live to tape, so I had just come from a cesarean section to do this, and I'll say, like, watching a baby born never gets old. Like, it never gets old. But when it's your own, it's a very different experience altogether.
Yeah.
Um, but I think also, just finding those ways to be involved and have those conversations early was very helpful. And actually, that was in Alberta, and I came into that expecting it to be a bit of a negative experience, just based on my preconceived notions of what that would look like, and it was for the most part pretty good. So, I think I would be very positive, about this. And to your point, your kids are older. My kids are kind of tweens. I think for a lot of newer families nowadays, I think they'll find as well, we're maybe not as unique, or not that you're not special, very special, but not as,
Yes.
like,
Yeah.
unique to the point of, like, confusion
Right.
as you think you will be. So, I think that also makes for a very positive experience.
For sure. Absolutely. I, now, this next question is obviously got a little bit of bias associated with it because you're here, you're being interviewed by me, and so obviously you see that there's maybe some value in doing a show like this. But when you were creating your own family, do you think that a show like this would have been helpful for you? Like, what would you want to see included or not included?
Uh,
Who do you think key players should be to make the show as robust as possible for what you experienced on your journey?
so I went to a baby show in Hamilton. I wanted to check out one of those expos and see kind of what it was like. And my favorite experience was someone giving me a breastfeeding pamphlet. And I said, respectfully, I said, that's great. I said, my kid has two dads and is adopted, so I don't think we'll need that. And they kind of stared at me with a puzzled look and just said, well, just take the pamphlet anyways. And I thought, okay, yeah, I'm happy to do that. So I think, you know, people involved in maternity care, as we call it, and, like, and I don't want to call it the birthing industry. That sounds really bad, but I think those of us who invest our lives in creating families, and that we feel very strongly about what we do, right? But I think approaching it with a bit of humility as care providers would be really helpful. I think it would have been just nice to know that people have been through it, their ups and their downs, things to watch for. Just because every step in my journey has been more positive than I thought it would be. Actually, other than, again, for anyone who's going through it or has gone through the adoption run knows that it can be tumultuous, and anyone who's struggled to create their families know there can be ups and downs. But I think, you know, I've I approached it with probably more pessimism than I needed to. And I think having opportunity for us to have spaces where we can share that and see that positivity is very helpful. Um, but also to recognize, I think, the diversity of our experience, and not everyone has a happy ending, and that's okay too. And how do we support them? So yes, I mean, not just because you're here, I think it would be very helpful, but I think um, like that, I tell that story, that pamphlet story, to everybody. I just think it's so funny. It's the only thing I can remember about that baby show was getting the breastfeeding pamphlet, and
Yep.
and actually feeling very inadequate. I will be honest, feeling like, wow, there's nothing I can do that's gonna replace the fact that my kid doesn't have a mom and can't breastfeed. And that was like the one space I probably didn't want to feel that way when I
Hmm.
was looking for a little bit of validation. Um, so yeah, I think, but I just think it's also funny. But I think how far we've come in that time, and I
Sure.
think, yeah, yeah.
Yeah. No, fair enough. Is there anything that we haven't covered yet that you wanted to make sure that you shared with people so that they had a true kind of understanding of where you're coming from?
Yeah. Um, I think that, what do I want to say? That's a good question. um, I think that there's a tremendous amount of diversity within our community, right? And I think it's also important for people to understand. I'm presenting, my experience, which as a a white settler, with a good job and education, was able to navigate the system very easily, and I totally recognize that privilege. I think that I would just again reemphasize, like, we're not as different when it comes to giving birth and creating families as probably many of the other couples that
Hmm.
are going through it. And I think for those of us who obviously have to try a little harder to create our families, be that fertility therapy or a surrogacy or adoption, I don't think any of those people will come to building their families in that sort of traditional narrative. And actually, there was some strength in helping other people in that journey who may, be cis hetero. um, but I think that because there are so many communities and message boards and practices, and because we see a lot of this happening across the country, again, I think recognizing that there is a community who very much wants to help our community create their families, be they through fertility clinics, be they through midwifery, be they through obstetrics, the hospitals themselves, community providers, and I think I think we do it better to some extent because we know. So I'm a little biased, but I think if you're not getting what you think you need to, I think it's okay to ask. I birth plans and doulas and some of the help that we enforce when it comes to a birth, I think they are very helpful. I think sometimes we want to be avoid being too rigid in our expectations, just because I think your overall birth experience, it's been shown, is kind of better the more open-minded you are to knowing that
Sure.
life happens, right? So
Mhm.
but identifying early on for yourself what those really important pieces are of your experience, and if you're not totally comfortable advocating for yourself for that, allowing other people to help you do that, I think it's just really helpful. And we've gone away from doulas in particular in the pandemic. And I think, again, as queer people, where we have our chosen families, our support people might not be our blood relatives, for example, at a birth.
Mhm.
I think it's important that we find ways to engage them. And again, I think to reiterate to service providers, why it's important for us to do that. But overall, it's going to be a better experience than you think it's going to be, and then
Yep.
parenting is like way harder than you think it's going to be. So
It's very true. It's very true.
I, I think that's it. But yeah, I think we're getting there. Yeah, it's different. Times change, and I'm sure for other people who've been watching, and for people like your experience would have been very different than kind of what it is now. But I love we have this critical mass of people that we can come together and
Right.
and do shows like this. I think it's wonderful.
Yeah. No, I fully agree. I don't know how easy it is for people to just call up your office or ask their family doctor to refer to you. And I know you're in the Hamilton area, maybe not all the viewers would be, but is there, if not connecting with you, is there a space where members of the community can go
Yeah.
when they're looking specifically for a care provider through the journey, whether it's through adoption, whether it's through surrogacy, whether it's through, in your case, obstetrics and gynecology, where they don't have to do a whole lot of digging to find a
Yes.
community member as a care provider.
Yeah. So in Ontario, Rainbow Health Ontario does allow service providers to sign up and identify as being queer positive, and I would say most probably belong to the community as well, although it may not be identified in that way. Family doctors can always reach out, if they're needing help with referrals, and certainly they can put referrals in if they need to. My practice is a bit busy, and I do narrow over time, but I think also the more information you can provide to that clinician to help us to understand maybe why this person should be taken on, I think is very helpful. But also, you know, like in all spaces, we have our underground queer community kind of within OBGYN. So, we also know who each other is. If you're in another area, and maybe I can help direct you
Sure.
into that space. So I think that there are a lot of opportunities to do that. Um, I think actually like doing a little bit of homework, especially nowadays with message boards, can be very helpful.
Mhm.
When I started seeing a lot of queer trans patients, I think it was very stressful for them, and I honor that they trusted me. But as you know, then your name gets out there and you build a bit of reputation for being a safe space, which is also, of course, a privilege. It's easier for people, but I think it's okay to use those to get a sense of
Sure.
what was that experience, and I think also having that conversation between midwives and your primary care provider can be very helpful to understand like what do we need, what we need to get ready, in terms of adoption. Sometimes running just a history past a pediatrician or an OB or a family doctor can be very helpful, and I encourage people to do that. And through even through surrogacy options, sometimes it's having that conversation with the healthcare provider around maybe which parent would be the more suitable one to have a pregnancy if there's medical issues. There's a whole spectrum of care that we provide. So engaging people early can be very helpful to know what we can do
Sure.
to be helpful. And I think again, I think it's nice to have other care providers to know that it's not that element of it when when we're having these delicate conversations around health risks and things like that. It's other things, but allowing us to be a bit more candid, maybe because we know we're just a part of that space, can be
Mhm.
helpful. um so yeah, hopefully not too many viewers are in areas where they feel like they don't have anyone to turn to, right?
Mhm.
And virtual care is also making it us more accessible, even if it is for that one-off conversation. So yeah, I would reach out, lean in on your family doctors as well to kind of help us. Midwifery practices, I think, have notoriety for being more inclusive and queer positive, but I would still encourage people to do a bit of homework and have those conversations with other community members.
Mhm.
Because it is a privilege to call ourselves safe spaces. We want to make sure that they are safe.
Mhm.
Um, and yeah, reach out.
That's
Yeah.
perfect. That's
Yeah.
perfect. I want to thank you so much for taking the time to join me today and to tell people a little bit more about your story and the work you do. It's invaluable and it's very much needed and appreciated. So thank you.
Yeah, thank you for doing this. It's been an absolute pleasure, and enjoy the rest of your time.
I will.